Creutzfeldt-Jakob disease is a rare degenerative fatal brain disorder that affects 1 in every million. It belongs to the transmissible spongiform encephalopathies family of human and animal diseases. The onset of this disease usually occurs at about 60 years of age, and 90% of sufferers usually die within the first year of having the disease. Creutzfeldt-Jakob disease is broken down into 3 categories: sporadic, hereditary, and acquired. Sporadic CJD is the most common and affects about 80% of the people diagnosed. There aren't any risk factors that can lead you to have this type. Hereditary CJD affects 5 to 10% of the people diagnosed and is caused by a genetic mutation. Acquired CJD is the least common type that affects only 1% of the people diagnosed. It is usually caused by exposure of nervous system tissue, including the brain, during a certain medical procedure. Early symptoms of Creutzfeldt-Jakob disease includes rapidly progressive dementia, problems in muscular coordination, changes in personality, impairment of memory, judgment, vision, and thinking, and depression and insomnia may occur. Severe symptoms of CJD includes mental impairment, myoclonus, which is involuntary muscle jerks, blindness, inability to move or speak, coma, development of infections such as pneumonia that can lead to death. Symptoms of CJD may be similar to those of Alzheimer's disease, but to accurately confirm the disease, an autopsy needs to be done because CJD causes a unique change to the brain tissue. CJD is caused by prions, which are harmless proteins found in human body cells, but once they become abnormal, they clump together, which leads to neuron loss, brain damage that is seen in the disease. The way the brain damage occurs is yet unknown. CJD can also be inherited. Prions can become infectious if mutation occurs in the prion gene, or if the prion gene becomes mutated in an egg or sperm cell that will ultimately be passed down to the offspring. CJD cannot be transmitted through the air or casual contact and is not contagious, but the disease can be transmitted by coming into contact with an infected person's spinal cord fluid or brain tissue. There are cases of people contracting the disease from cornea transplants, dura mater grafts, implantation of unsterilized electrodes in the brain, and injection of contaminated growth hormones from the pituitary gland. The chances of contracting CJD through medical procedures has greatly decreased through the improvement of medicine. This time, there aren't any diagnostic tests that can diagnose someone with Creutzfeldt-Jakob disease. However, if a doctor suspects someone of having CJD, they'll administer tests such as spinal taps and giving the patient an electroencephalogram that will rule out treatable forms of dementia such as encephalitis and chronic meningitis. CT scans can also rule out brain tumors and signs of stroke. MRI scans of the brain can reveal the pattern of brain degeneration to determine if they're caused by CJD. Unfortunately, there is no way to treat CJD, but current treatment is alleviating symptoms for sufferers by prescribing them opiate drugs and sodium valproate for the myoclonus. Precautions that can be taken to prevent the spread of CJD includes covering cuts and abrasions with waterproof dressings, wearing face protection when coming into contact with splashing blood or spinal fluid, disposing clothes that came into contact with a patient. Avoid cutting or poking yourself with instruments contaminated with blood. Soaking instruments that came into contact with a patient with undiluted chlorine bleach. Thank you for watching. If you liked this video, leave a like, and if you want to see more quality content, then subscribe and click the notification bell at the bottom of your screen.